Well, it's a month marked by the color pink and self-empowerment. October is Breast Cancer Awareness Month, a time to promote screening and prevention of the disease. Research shows it affects about 1 in 8 women in the U.S. every year. And right now we're joined by Dr. Heidi Rogers. She's an oncologist with Mercy and a breast cancer survivor herself. And how are you feeling this morning?
I'm feeling great. Thank you for having me.
Thank you so much for being here, Dr. Rogers. We obviously understand you're a breast cancer survivor as well. So how do you use your personal experience in your daily work? And what's your message to any people who may be fighting breast cancer this morning?
Well, I think having had breast cancer myself really helps that I have a deeper understanding of what people are going through.
Yeah. Well, we know mammograms are a huge way that you can sort of get a hold of this thing, right, ahead of time. So talk a little bit about how frequently you should get them and when you should get them, what age?
So everyone should start at age 40. If you have a family history, you should start sooner than that. And it's important to know if your breast tissue is dense. So Missouri has a law where they will inform you if you have dense breast tissue. Dense tissue means that you have more fibrous and glandular tissue compared to fatty tissue. And if this is present, it can be harder to detect small breast cancers.
And mammograms, we know, are the most effective way to detect breast cancer, but there's also, self-exams that women can do at home. So what should women know about doing self-exams to themselves?
So I think women should check themselves. I found my own breast cancer myself. So it's important to check yourself at least a couple times during the month. I think women know their breast tissue best.
Yeah, so it's important to really talk about this stuff, these treatments especially year-round. Why is Breast Cancer Awareness Month so critical, and why do we celebrate it here in October?
I think it's critical just to keep people informed, to keep people aware, and it's important for, patients.
Yeah, for sure. Obviously, every woman has a different story. Is there any sort of racial makeup? We see a lot of other communities that deal with it more, but I know it's a women empowerment thing overall.
Yeah.
And it's also in males.
Mm-hmm. We do. It's less common in men. Usually if men have breast cancer, there's a genetic mutation there. But we do see a high incidence in African American populations and Hispanic women with breast cancer. And sometimes they're unfortunately presenting with more advanced disease, so they're probably not getting their screening and mammograms like they should.
Last year I did a story with another Mercy oncologist about how she's seen just treatments get so much better with breast cancer. What's your message to people out there, worried as they're going through this? How good are the treatments and have they gotten better over the years?
They really have improved over the years. So most people with early stage breast cancer survive and do well. And we have really effective, targeted, personalized medicine for people whose cancers do come back.
Thank you so much, Dr. Rogers. Thank you for sharing your story. I'm sure every single person that's been your patient is so thankful. Doctors have a special heart, but the fact that you've gone through this yourself, I'm sure makes your patients feel great.
It's close to home.
Thank you.
Thank you.
Appreciate it.